I have a story of a girl. She's like my peer. So on one of my outreach, I met her when I was talking to the people about health issues. She had been sexually abused by her uncle, which she lives with, and this resulted to pregnancy. And her uncle gives her money to abort the child and threatened to kill her if she tells anybody about the pregnancy.
During our outreach, I spoke with a young person about sexual and reproductive health issues. After a long chat, she told me that whenever she has sex with her partner, she always feels some pain.
Problems tó wọ́pọ̀ jù pàápàá jùlọ lórí àwọn ọmọbìnrin wa. Èmi máa ń sáré lóyún, sometimes ó kàn máa rìn káàkiri, wọ́n wà jobless, máa tẹ̀lé torí owó díẹ̀díẹ̀, wọ́n á tẹ̀lé ọkùnrin jáde, the end of the day, wọ́n padà lóyún. Torí òṣì àti àìní tó pọ̀ ní agbègbè yìí kò jẹ́ kí àwọn òbí kan lè rí àyè láti tọ́jú àwọn ọmọ wọn. Nígbà míì òbí á jáde látàárọ̀, kò ní bojú ẹ̀yìn wò pé bóyá òun ti fọmọ kan sí ilé. So yìí ó ń ṣokùnfà tó mọ̀ ní tó máa tẹ̀lé ọkùnrin lọ látàárọ̀.
Most of these youths, they don't really find it easy to communicate with their parents. They don't have that one-on-one contact with their parents. So they rather go out to their friends, their peers, and talk to them. Things that they should have spoken to with their parents, that they would have advised them better. But because of that lack of friendship between parents and the peers, the younger ones, so it's like that is one of the major problems that we have with them.
Àwọn ọ̀dọ́ ọkùnrin àti obìnrin ìbálòpọ̀ òun ló pọ̀ jù because ọmọ tí ò tí tó lóyún ó ń lóyún wọ́n á bára wọn lò. Ọmọ mi wà tí ó pé ebi ń pa ni nígbà bá ti pẹ́ fún un ní 10 naira á fara sílẹ̀ fún ọkùnrin wọ́n á bára wọn lò á dẹ̀ gba owó oúnjẹ ń bẹ̀. Àwọn ọ̀dọ́ yẹn àwọn tí ò tí ju ọmọ 12 lọ wọ́n ń lóyún. Àwọn ibẹ̀ náà láti máa rí bí wọ́n ti ń ṣẹ́ oyún tá ń lo kán bílálà èmi ni bàrà wọ́n á lò wọ́n á fi sẹ́yìn lọ́jọ́ kìíní bá yá wọn ò ní lè inú yẹn á ti bàjẹ́ wọn ò ní lè bímọ.
Bariga Local Council Development Area is a quite densely populated local council development area with vibrant youth. In particularly, the place in question, Ashogbon, located in Ilaje ward, is an urban slum and has a larger percentage of youth within that catchment area. And the sexual and reproductive health challenges that this youth face is not different from what other youths experience. Majorly, the challenges faced by these youths ranges from unsafe abortion, unwanted pregnancy, exposure to HIV/AIDS, including hepatitis, sexually transmitted disease, substance abuse, and involvement in cultism.
Bearing in mind that the primary health care facilities are the closest to young people in the community, and these are the places that they ought to be getting services from. But what we find out is that these services are not available, either because the providers are biased, there are no spaces available to them, and those other kinds of issues existing currently. So that's what created an interest in ensuring that services, particularly in slum areas where there are a huge population of young people that are in dire need of these services, and also they have different outcomes: poor SRH status, unintended pregnancies, STIs and HIV in the community. So that's the reason why we decided to focus on these facilities and ensure that services are delivered to young people.
Action Health Incorporated is primarily established to catalyze the development and well-being of young people of Nigeria through partnerships with various stakeholders, including young people themselves, government, communities, parents, religious institutions, media, and a wide range of groups of people who are genuinely interested in making a difference to the health and well-being of young people. The grant that AHI won mandatorily was to make us work at community level, to get a greater community involvement in the integration process. And therefore, two things that we did critically was that first we worked with young people in the communities, and then we worked with what we call community accountability watch groups. The community accountability watch groups are the larger community stakeholders, including CDAs, women leaders, market women, religious and faith-based leaders, trade groups in the communities, who all came together and said, listen, for our own future to be guaranteed, we needed to ensure that the young people in their communities have access to youth-friendly health services. And they worked alongside with the medical officers of health, the primary healthcare facilities, and all cadre of healthcare staff. So there is now a greater synergy so that the communities are interested in what is happening in the community, in the health center, and give feedback. So they are not just recipients, they are critical investors in their own health.
The Lagos State Primary Healthcare Board and Action Health International, in partnership with Action Health International, trained some health workers on youth-friendly services. Following that, there has been a tremendous change in the health-seeking behavior of youth in Yaba local council development area. Lots of them have actually assessed our PHCs, and we're happy to work with AHI for the betterment of these youths.
I gain a lot because our community leaders gone so I sensitize àwọn èèyàn àdẹ̀dìde sí nígbà wọn gbé program yẹn dé wọ́n dẹ̀ fún wa láwọn èèyàn bẹ́ẹ̀ pé wọ́n wá síbí so wọ́n address wọ́n bá wọn sọ̀rọ̀ so àwọn náà àwọn CDS yẹn náà within the community àwọn náà ló múyàn sílẹ̀ so àdẹ̀rí result.
Further improve on this intervention. If we have this kind of services attached to more of the health centers we have around, I think it will actually improve on the adolescent health services.
Since the commencement of the Action Incorporated program, we've been facing a lot of flow of patients into the PHC, which is encouraging. I will just advise if this program can be taken all around the PHC in Lagos State so that other communities too will benefit from it.
It should be a permanent program in the healthcare sector such that youth-friendly nurses, youth-friendly doctors should be trained, and the program that we have started should not stop abruptly or delay after.
If our government can encourage, can put in place in other PHCs the youth-friendly services, maybe it will be of help to more parents, and our youth will be accessible to the treatment.
Èkínná hospital wa ìkéré, a rò pé bóyá option ni wọ́n máa gbégbá àwọn grade yẹn. Èkejì, àwọn òṣìṣẹ́ wọ́n dínkù díẹ̀, òṣìṣẹ́ ọ̀pọ̀ tó bẹ́ẹ̀ gẹ́. Ṣé o pé àwọn tó bá wà ń bẹ̀, èmi as ward committee máa wá bẹ̀ láàárọ̀, máa wá wò wọ́n, wọ́n á dẹ̀ ṣiṣẹ́ títí di 3 o'clock kó tó lè ní rest. Èrò dẹ̀ ń pọ̀, at least àwọn tó ń wá bíbá ìgbà mi à ń fọ́n náà tó tó 180, 200 èèyàn tó ń wá sí ibi àtọ̀dọ́ àti àgbàlagbà. So èmi kàn bẹ̀ ìjọba pé tí wọ́n bá lè upgrade kìíní sí general hospital kò bá dáa.
To make Lagos a better place to live in, we must recognize our strength in diversity, a common national identity where everybody counts. I shall run an open government of inclusion that will not leave anyone behind, no matter your age, sex, tribe, or any other status. As long as you reside in Lagos, we will make Lagos work for you.